Hi everyone. For today's video, we just had some patients submit some frequently asked questions that they had about chiropractic, and I'm going to answer those here for you real quick. So, first one that we have is actually from a new patient that they had never heard of chiropractic care. So they just asked simply, "What is chiropractic?" And if I was going to answer that in a fairly simple way, I would just say that it's a surgery-free and drug-free way to address musculoskeletal disorders primarily. So essentially what that means is we're working on the skeleton, so your bones, muscles, joints, ligaments, tendons, through the chiropractic adjustment, which is either done manually with your hands, or I can use an instrument to help assist with that as well. And all that those adjustments are doing are restoring the proper motion in each spinal joint that we're working on, as well as helping to align the spine to where it should be so that things can function optimally. Next question is, what are conditions that chiropractors treat? Super common ones are obviously neck pain, back pain, headaches, sciatica, which is a neurological pain that comes from your lower back and goes down your leg. Similarly, in your neck, you could have a thoracic outlet syndrome, which is a pain that comes from your neck and goes down the arm. Obviously, there's a wide array of things that we treat, but those are a lot of the big ones that will drive people into our office. Let's see, what kind of training do chiropractors receive, and is chiropractic safe? Yes, it is safe. And we are trained to essentially adjust things in a certain line of drive or a plane to keep you safe. So your joints are all aligned in a certain fashion, especially the ones in your neck. And this is where it gets real iffy if you're adjusting your own neck. It's really hard to follow those specific lines of drive if you're doing it yourself, but chiropractors are trained. We go to school for essentially 3.5 to 4 years on top of our undergrad so that we can learn these different things, the nuances of the body, and that way we can help keep you safe as we're trying to treat you as well. So let's see, we got two more. Can children or pregnant people benefit from chiropractic? Yes, they can. Especially, most of you know, Dr. Maria Rapp in our office is great in these two populations right here. Especially the pregnants, while they're in their pregnancy, typically do a lot better afterwards after getting treated while they were pregnant. It's not just something that they did, just towards the end of their pregnancy. They basically were getting treated the entire duration and then some afterwards, and that helps keep mom and baby both doing very well. And they respond very, very greatly to it, as far as I know. And then I've even seen she's adjusted children, like newborn babies, the day after they're born. So there's not a bad time to get started with chiropractic. And obviously, this is going to lead into our last question, which is, how long will I need chiropractic care? It's not so much a matter of how long you need it. I would obviously advocate that everyone needs it. And most people, when they first come in, were correcting the spine. So that takes a lot of time, like it does to work out. If you're trying to get in shape or lose weight or gain weight or whatever the case is, it's not something that's done in just 1 or 2 gym visits. This is the same type of principle. This is something where you have to essentially retrain your spine how to move properly with these adjustments, and how to move properly while it's in the correct place. So those are two things that it's hard to even think about when you're just focused on pain. And so that's why we work on the entire spine, to make sure that the entire body systemically is working how it should. And essentially, after you get done with that initial treatment plan, after everything's corrected, then we put you on a maintenance plan that's, for everybody it's different. For some people it's once every week, some people it's once every month, and anywhere in between. Just as long as you're maintaining that correction of your spine that we got, that's ideal. And the answer to how long is hopefully your lifetime. That's not a daily commitment that you're having to make to a maintenance care. Once a month is very doable, and half the time for people, once a week or once every 2 weeks is very doable too. So it really just matters how you have to determine how much it matters to feel good to you. And this is a great thing to help you feel good in the long run, even when things are corrected and you're not necessarily in pain. So I hope you enjoyed these answers to these questions. And if you have any other further questions, feel free to either post on our social medias, whether it's Instagram, Facebook. Feel free to shoot us questions or just call in and stop in our office, and we'd be happy to answer those and treat you as well. So everybody have a great Wednesday.